Hi, I'm Suzy Cohen, a real-life pharmacist offering real-life solutions. And today's question comes from Sandy in Ocala, and she writes, Dear Suzy, how come every time I take an antibiotic, I get a yeast infection? Is there something that you can tell me that's a secret that will help me stop getting these annoying infections? Thank you. Sandy, yes, there's a lot you can do. Antibiotics go off in your body like a shotgun. A lot of people already know this. Men can often get jock itch, women get yeast infections. It's very common because they're killing the bad bacteria and they're killing the good bacteria. And when your good bacteria is gone, then your healthy camp of flora, intestinal flora, is gone. And what happens is yeast jumps in, takes advantage of the situation, starts multiplying like crazy, and you wind up with a yeast infection. That's what's happening. Then you have to run over to the pharmacy and pick up some Monistat or some Vagisil, and you know the drill, obviously. So the way to prevent these things is to take a probiotic when you start your antibiotic, and the probiotic replenishes your healthy camp of bacteria. It's that simple. And you can do that with any number of probiotics. They're usually kept in the refrigerator section of your local health food store. There's a lot of brands. Turn over the label, make sure it's got a lot of long names like Lactobacillus acidophilus and Bifidobacterium, and the more long names the better, and they usually come in like millions and billions of units, so that's fine. I would take it about 4 to 6 hours away from your antibiotic dose. So if you're taking, for example, a Z-Pak or Zithromax, that's a very popular antibiotic, and you take that tablet at 9 in the morning, then I would take your probiotic around 1 or 3 or 4 in the afternoon, somewhere away from your antibiotic, so it doesn't go in and kill off all the good bacteria that you just took. So I hope that makes sense. And also, if you want to prevent these infections, you could try garlic. Eat garlic every day, like 2 cloves a day. Just lightly saute it, mince it, and you can roast it like my husband does. We put it on crackers and just eat it straight. But garlic is a known antibacterial and antiviral and antifungal. It's very powerful. It might help you prevent these infections to begin with and strengthen your immune system.
What about yogurt?
Oh, yogurt. Well, that's a great question. A lot of people feel that yogurt is a great source of probiotics. I prefer the supplements. I just don't think that yogurt is handled well by many people because a lot of people are lactose intolerant or they're allergic to the protein called casein in dairy. And also yogurt, sometimes it's colored with bugs, for real. It's colored with, red dye, some of the candy-like yogurts, and that comes from cochineal beetles. They crush them up and powder them, and it's bug juice, trust me. If you're getting red yogurt, most of the time it's from that. Now, I'm not saying that exclusively because some of it just is colored from like the red strawberries that they add, but a lot of the fancy yogurts, especially for kids nowadays, they're colored with that stuff, and to me that's gross. And also, I don't think that the cultures that they use in the yogurt are that effective anyway. Some of them don't even survive the stomach acid, whereas supplements do. And so if you'd like more information, go to my website. It's dearpharmacist.com. Oh, one other thing. Everybody's asking me about my fish. You know how Johnny Carson had Ed McMahon as his sidekick and Chelsea Handler has Chewy? Well, I have lychee nut. It's my pet fish, and he hangs around with me and does much of nothing, but I like him. And I'll see you next time.